Thanks for joining us today. Welcome to the Center for State's video series on implementation planning and capacity building. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Implementation Planning and Capacity Building Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to planning the implementation of an activity, program, or intervention to address a problem or need, and consider strategies to building agency capacity to implement it. It does this by providing step-by-step guidance to prepare for implementation, make a plan for addressing any gaps or capitalizing on strengths, and then develop a plan for implementation that includes the actions needed to get ready, actions needed to implement, and actions to measure implementation progress. Implementation planning and capacity building is broken down into 3 parts and 8 essential functions, or steps, that may be presented linearly, but they often overlap, and teams will loop back and forth between them. At this point, teams should have outlined the elements to include in their plan, identified the sources to pull the information from, and considered the context, then revisited their teaming and leadership structure, reviewed readiness assessment findings, developed strategies to build capacity and strengthen motivation for implementation, identified work plan activities to get the intervention and agency ready to implement, and work plan activities to roll out the intervention and measure implementation progress. In this module, we look specifically at identifying communication and engagement activities of the work plan. Before moving on to consolidate and review the plan as needed, let's get started. Another important part of implementation planning is thinking through communication and engagement strategies. Having a clear plan to communicate before and throughout implementation helps to build and sustain motivation and buy-in for the intervention. Planning in advance who to message, about what, and when helps teams to provide clear and consistent communication throughout the implementation process. This helps keep key stakeholders, including leadership, partner agencies, staff, families, and youth, and the community, informed on progress and engaged in the change process. Communication and engagement will be vital to obtaining and sustaining needed buy-in, support, and motivation, all critical to implementation success. Communication strategies should align with and build from the team's communication plan and external communication strategy. Teams should plan and document strategies for engagement and communication with agency leadership, agency staff, partner agencies, for example, courts and community organizations, or individuals involved in referrals, service delivery, or implementation support. Target population members, including both potential and actual service recipients, as well as other key stakeholders and the community. When developing communication and engagement strategies, teams should try to strengthen motivation for implementation and build a receptive organizational culture and climate. Teams may need to think beyond keeping groups informed and consider how they can shift attitudes and build needed buy-in and support for the intervention. For example, thinking about the intervention and implementation efforts from a marketing perspective and delivering targeted messages through a variety of different channels, as well as getting feedback from stakeholders. Targeted messages can also support shifting attitudes or build buy-in that are specific to readiness findings. Some teams may choose to partner with external communication specialists to develop targeted and engaging materials that clearly explain how the intervention supports and benefits various stakeholders and the target population, and aligns with shared goals, values, and other agency initiatives. What will help teams as they identify plan activities for communication and engagement? Teams should think about what mechanisms or protocols are needed for team members and subteams to communicate with each other about the progress of implementation and monitoring results. This communication strategy should be reevaluated often as implementation needs and teams shift. Teams should consider how to highlight the benefits of implementing the intervention for the agency and for the children and families who will receive it. What are the anticipated outcomes? They should also identify how the new intervention connects to ongoing practices and initiatives. How does the new program or intervention align with or complement other practices? And reflect on the strategies developed to increase motivation for implementation. How can these inform the messaging and communication to increase buy-in for the intervention? Let's take a look at an example. When Washington State adopted a new child welfare practice model, it followed a structured implementation framework that included creating an implementation plan with a detailed communication plan. The communication plan described the approach for communicating practice model changes to community stakeholders and staff at all levels. To promote acceptance and understanding of the ongoing change, the communication plan included 3 components. Marketing messaging centered on key message themes delivered through a variety of channels. Outreach messaging was to share information on the benefits of the practice model changes, set realistic expectations, reduce anxiety caused by the change, and encourage adoption of the model. And monitoring messaging to assess changes in organizational awareness and acceptance levels. The plan outlined communication activities, frequency, individuals responsible, and communication tools intended to support consistent and targeted communication. Let's take a moment to check in on what you've learned about identifying communication and engagement activities for the work plan. Why do teams identify communication and engagement activities? To build and sustain buy-in and motivation, plan for who, when, and what to communicate, and keep key groups informed. How do teams identify communication and engagement activities? By developing communication strategies for each key stakeholder group and target population members, and considering messaging strategies to shift attitudes where needed, as well as inform. What can help teams identify communication and engagement activities? By highlighting the benefits of the intervention and capitalizing on motivating strategies and messaging, and connecting the intervention to existing practices, goals, and values. Now take this a step further by reviewing the reflection questions for identify communication and engagement activities in your implementation planning and capacity building workbook to connect what you've learned to your own experience. Up next is Consolidate and Review the Implementation Plan, the 11th and final module in this series on implementation planning and capacity building.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.